I, Dr. Shagun, welcome you all to another session of Cancer Care at American Oncology Institute, Gurugram. Today's topic for discussion is ovarian cancer. To discuss this topic, we have Dr. A.K.Dhar with us. He is an eminent medical oncologist and expert in treatment of all kinds of cancer. He has got special interest in treating ovarian cancer. I welcome him on behalf of AOI Gurugram.
Thank you, Dr. Shagun.
So, what is ovarian cancer?
See, ovaries are the gonads or the reproductive system in females. And it is they are situated deep into the pelvis. And there is one pair of ovary in every females. What happens is that in those patients who suffer from ovarian cancer, the cells or the abnormal cells which are on the surface of the ovary or on the fallopian tube also. See, cancer ovary is not only ovary of cancer, but the cancer of ovary plus fallopian tube also. And these cells, they start multiplying very fast. And they are immature cells. They keep on accumulating on the surface of the ovary and adjoining area. And they cause tumor on the surface of the ovary or in the adjoining area or in the abdominal cavity or somewhere in the distant sites, and they cause cancer in the females.
Sir, can you tell us how ovarian cancer is different from lung cancer and breast cancer?
See, ovarian cancer is in layman term called silent cancer. Why it is called silent cancer is that we are not able to detect ovarian cancer for a long time. Reason being that the symptoms of this ovarian cancer are the symptoms of common problems. Like the patient will complain of abdominal distension, which can happen in other abdominal disorders. They can cause giddiness, weakness. This can happen in other neurological problems or cardiovascular problems. And sometimes these ovarian cancer can cause swelling of the abdomen, which can be misled or which can be confused with other abdominal disorders. So why it is so? The reason is that the ovarian cancer, as I told you in my previous question, the cells, they start multiplying, and they are not accumulated on the ovary, but they keep on falling in the adjoining area. When they keep on falling in the adjoining area, they spread in the abdomen. They spread on the fallopian tube. They spread on the omentum and cause abdominal problems. That's why the symptoms are not clear-cut of ovarian disorder. And by the time the cancer is detected, it's already late. Either the patient comes and stage 3 or stage 4 disease.
So, what are the clinical manifestations of ovarian cancer?
As I told you, the clinical manifestation are usually the patient will have bleeding per vagina, they can have anorexia, they can have weight loss, they can have abdominal distension, they can have other gastrointestinal issues because of the compression. They can have abdominal swelling, giddiness, weakness. As I told you, these symptoms are not of a particular ovarian disorder. They are of general symptomatology. That's why I told you earlier also that the detection of ovarian cancer is detected or it is detected late.
It has been seen that ovarian cancer gets unnoticed for a long time and manifests as advanced stage. What is the cause for this? manifestation, sir?
As I told you that the ovarian cancer does not have any specific symptom of an ovarian disorder. So they cause general symptoms more as compared to symptoms related to the ovarian disorders. And they keep on propagating, they keep on moving from ovary to abdomen to omentum to liver to lungs, and they manifest with distant disorders.
Sir, can you tell us about the causes of ovarian cancer?
See, the exact cause of ovarian cancer, or to pinpoint the exact cause of ovarian cancer, it's difficult. It may be related to the parity of the lady. It may be related to some genetic disorders like BRCA, that is breast cancer gene 1 and 2. It may be familial, with the history of ovarian cancer in the family. The chances of getting ovarian cancer in other siblings or in blood relations become very high. And in some studies, it has been shown that endometriosis may be related to as one of the cause for ovarian cancer, but still the studies are going on. There are only conjunctures. But one thing is very clear, that if the ovary cancer comes in the family, we have to screen the entire family.
Sir, is there any genetic correlation?
Yes, definitely. As I told you that the BRCA gene, BRCA1 and BRCA2 gene, they are related to ovarian cancer. And once we find BRCA correlation to the ovarian cancer, we have to treat the lady accordingly.
Sir, kindly tell us what are the types of treatment available for ovarian cancer?
See, every cancer has to be operated. But unfortunately, as I told you, that in our country or in Western countries also, the ovarian cancer is not detected at early stage. So surgery, although it is a number one choice, but perforce we have to give some medications, some chemotherapy or targeted therapy to downstage the disease. And once we downstage the disease, we can operate the patient accordingly. So broadly speaking, if you ask me, the treatment of ovarian cancer is surgery plus chemotherapy, which can be combined with targeted therapy and immunotherapy. Targeted therapy, immunotherapy, anti-BRCA therapy, which is related to gene, has got big role in treatment of ovarian cancer.
And sir, is there any role of immunotherapy?
Yes, as I told you, that immunotherapy has been used, targeted therapy has been used in the treatment of ovarian cancer, and we are treating patients. We have treated patients of ovarian cancer at American Oncology Institute at Gurugram and earlier in Imphal also with targeted therapy, and some of the patients with immunotherapy. These treatments are available at American Oncology Institute, and we are getting gratifying results. People are happy, and with the with the introduction of this kind of treatment, the survival has improved, the quality of life has improved, and both the patient and the clinical fraternity, they are happy with this kind of treatment.
So in the last, any message you want to give to the audience, sir?
See, one thing is there that one must understand that ovarian cancer is rapidly increasing in the population. And 1 out of 75 ladies or 1 out of 80 ladies are likely to get ovarian cancer. And 50% of these patients, they do not survive long. My message to the community is that they should be very careful in monitoring their symptoms, and if some of the symptoms, like symptoms related to gastrointestinal tract, generalized symptoms related to abdominal swelling, abdominal distension, or vaginal bleed, they are not resolving, then they should immediately contact the doctor. The second message is that we should get ourselves screened as per the indication. We should get a tumor marker done, which is called CA-125, or ultrasound abdomen and pelvis done if it is indicated. And lastly, my message is that protect yourself, protect your private parts, fight like a little girl, and if at all somebody gets ovarian cancer, she should be treated at the priority at a recognized cancer center like American Oncology Institute. Thank you very much.
Thank you, Dr. Dhar, for this informative session. Thank you, audience, for watching the live session. Stay tuned.